Compare hospital-based care versus private, outpatient-based care.
Hospitals. I have a lot of respect for them, so I don't mean to denigrate hospitals at all. They're big, they're powerful, and when one has advanced disease, trauma, there's no better place than to get it done in the hospital. That being said, the hospital is the single most expensive environment to undergo healthcare, and it's not always better. Sometimes for certain things, in certain situations, it can be worse than some alternatives. When it comes to PAD, peripheral arterial disease, overwhelmingly most PAD is non-urgent. It's not an emergency. And patients have low comorbidities, most of them, and they can and should safely be done in the office-based lab or the OBL, which is what we PAD specialists, what we have. All of our facilities are OBLs. You'll get the best service there. You'll have easy parking. You'll have customer service, concierge like customer service. You won't have long wait times. You don't have to wait weeks to get an appointment. You'll see us within days. You can have great interaction with the staff and the physician. You won't have to go through multiple layers of communication. And the experience is going to be par excellence, and your outcome is going to be the same or better than you get in a hospital. Bonus, cost 60% lower on average in our OBL. Cost savings to society, that's a big deal. We emphasize that. We want to help patients, identify more patients that need treatment, prevent downstream more expensive and more invasive open surgical bypasses and amputations, but we also want to drive healthcare costs down, and we're doing that. For you, the patient, that means a lower copay on your part. So the OBL for non-urgent PAD, which is most of PAD, is definitely the best environment. The hospital is good for PAD with patients with comorbidities, morbid obesity, unstable cardiopulmonary positions for sure, unstable cardiopulmonary conditions for sure the hospital. Even though cost more, cost be darned, if you have high risk in that small category, the hospital is a safer place to get it done. In general, the question is, how does it compare in general, hospital-based versus private outpatient like ours? One must remember, the hospital, 60% of healthcare dollars, 60-65% are from Medicare. Same thing with hospitals. So hospitals are effectively a government agency, subsidized by the taxpayer dollar. Whenever you have that, third-party payers, subsidies from the government, inefficiency ensues. It's natural. Think about your experience when you go to the US Post Office versus FedEx. Then you kind of have an idea of the difference between a hospital and a private outpatient facility like ours. We're not subsidized by the US taxpayer. We have to live and die by what we do and how we do it. There's no safety net. So we do it better, faster, and at lower cost. Hospitals have that safety net, various direct and indirect subsidies from the taxpayer. They tend to be more inefficient. Again, not to denigrate them, they're excellent at some things, and they're the absolute right option. But for a lot of things that are non-urgent, can be done safely in the outpatient setting, like PAD specialists and PAD revascularization, outpatient private sector is often the way to go.